Welcome to Medicine Handy Point. Today we will discuss a very important and challenging topic, which is coagulation cascade and the anticoagulant drugs. Now, let's start with the coagulation cascade. So, the screen has been split into two portions. Down portion, we will start with the common pathway, and in the up portion, we will discuss extrinsic pathway and intrinsic pathway. So, let's start. So, the coagulation cascade, we will focus first on factor 10. Factor 10, with the help of factor 5, activates factor 2. And activated factor 2 is called thrombin. Activated factor 2 then activates factor 1, and activated factor 1 is fibrin. So all this is called common pathway. So this is the common pathway. How you memorize it, everything here is a multiple of 10. So 10, 5, 2 and 1. These are all multiple of 10. So remember it like that. Now, when there is a tissue injury, there is release of tissue factor, which activates factor 7, and then factor 7 activate factor 10. This is called in extrinsic pathway. So this is extrinsic pathway. How you remember this? Extrinsic mean the tissue is damaged from outside. So tissue factor release, which activates factor 7, and in 7 there are two E's, and in extrinsic starts with the E. So remember it like that. Now, what is intrinsic pathway? Intrinsic pathway starts with the 12, which then activate factor 11, which then activate factor 9, which with the help of factor 8 then activates 10. So it is 12, 11, we skip the 10 because 10 is here, 9, 8 and then 10. So this is how the factor 10 is activated in the intrinsic pathway. So I hope it clarifies the coagulation cascade. Now, what are the vitamin K dependent factors? These are factor 2, 7, 9 and 10, and protein C and S. How you remember this? So we remember this by this mnemonic. 2 plus 7 calculates to 9, not 10. So 2, 7. This C is for protein C, and this S is for protein S. 9 for this and 10 for this. So 2 plus 7 calculates to 9, not 10. This is how you can remember it. These factors production is inhibited by warfarin. So warfarin is the drug which inhibits the production of vitamin K dependent factors. Now, when there is a coagulation cascade, there are regulators in the body as well. What are these? Protein C and S, they are basically anticoagulant. They are regulate the excessive coagulation formation. And warfarin inhibits protein C and S. There is another regulator, antithrombin. Antithrombin inhibit thrombin, which is factor 2. And antithrombin is activated by heparin. Then there is tissue factor inhibitor as well. And then there is plasmin. Plasmin actually convert plasminogen into plasmin. Actually, there is plasminogen, and there is a naturally occurring tissue plasminogen activator, which converts the plasminogen into plasmin, and plasmin then split the clots in the body. Streptokinase is actually a tissue plasminogen activator, and it converts plasminogen into plasmin, and the plasmin does its work then. Now, let's discuss briefly the anticoagulant drugs. Now, the new anticoagulant drugs are rivaroxaban and apixaban. These are actually inhibitor of factor 10. So factor 10 is in the common pathway, and there is no test to monitor rivaroxaban and apixaban because there is no such test available to monitor the common pathway. So that's why there is no monitoring required for these drugs. Dabigatran, it inhibits thrombin, which is the factor 2. So again, factor 2 is in the common pathway, and there is no test available to detect the common pathway. So that's why no monitoring is required for dabigatran. Then heparin activates antithrombin 3 and inhibits the intrinsic pathway as well. This is actually true for the high molecular weight heparin. In low molecular weight heparin, which is enoxaparin, it activates antithrombin, but it does not inhibit the intrinsic pathway. So actually the low molecular weight heparin will require monitoring of the APTT because it inhibits the intrinsic pathway, while the low molecular weight which is enoxaparin will not require APTT monitoring because it does not inhibit the intrinsic pathway. Once again, I clarify that high molecular weight heparin inhibits the intrinsic pathway. So, high molecular weight heparin should be monitored with APTT, while the low molecular weight heparin, which is enoxaparin, does not inhibit the intrinsic pathway. It just activates the antithrombin. So, the low molecular weight heparin, enoxaparin, does not require any monitoring. Streptokinase and LTPase, they are actually tissue plasminogen activators and thrombolytic. I hope you like the video. Thank you for watching, and please subscribe to the channel.